Humanity First Uganda, under its program Global Health, reached out to the vulnerable, needy people of Mbale and its neighboring districts with a free medical camp at Ahmadiyya Muslim Medical Center in Mbale district, about 262 kilometers from Kampala, the capital of Uganda. This free medical camp served over 1,500 people of different walks of life from Mbale and 7 neighboring districts, including Wukedia, Abududa, Sironko, Soloti, Abudaka, and Chibuku. The camp lasted for 3 days, attracting volunteers from far and wide, most notably among whom was Dr. Zakaria Abdullah Yusuf, a rheumatologist working with National Health Services UK, and Dr. Betty Bilal Ahmad Tariq, a medical officer working with National Health Services UK. The camp served a number of people with different medical complications, and a number of medical services were offered ranging from antenatal, dental, ultrasonic scan, free open pharmacy, medical consultants, laboratory, counseling, homeopathy, and many more others. The Amir and missionary in charge, Al-Haji Maulana Muhammad Ali Kaile, along with the chairman, Humanity First Uganda, Mr. Mubilu Haluna, performed an inspection of the different departments put up to provide the best of service to the vulnerable. Speaking to the chairman, Humanity First Uganda, Mr. Haluna Mubiru, this is what he said.
In just 3 days, we've seen more than 1,300 patients who have been looked after, giving them medical advices and prescription. So there's really their need for such services. And basically, as Humanity First is serving mankind, we always look the most impoverished, most underprivileged. That's how we come in and help our communities.
The Deputy Director, Global Health, Dr. Abdul Hakim Mukwanga, was extremely humbled by the services rendered to the vulnerable people, and this is how he expressed his gratitude to the volunteers and funders of Humanity First.
It has been a successful camp, as you've already had the numbers that we've worked on. There are a few challenges here and there of probably the high numbers, because as we know, high numbers of over 500, it is an overwhelming number. But alhamdulillah, we've been given an opportunity by our patients to deliver medical services to them. I take this opportunity to thank our volunteers who have been with us throughout the entire camp. As I've just told you, we have a huge team of medical officers, over 8 medical officers, and all of them are volunteers. Thank you so much for joining us. We thank the laboratory team. We thank very much our donors who put money into Humanity First so that it can fulfill its obligations and fulfillments. Thank you so much, and continue to donate to Humanity First so that such organizations can still take place to the vulnerable communities of Africa.
In an explicit interview with some of the volunteers in this medical camp, they said,
So, alhamdulillah, we've been able to see quite a number of patients, ranging from diagnosing new cases like hypertension. Some of them are surgical cases, some of them are medical cases, including some of these are maternity cases as well. So we have a wide range of patients that we've been able to see. Most interestingly, some patients' understanding of the disease process was not great, so we've been able to take time and explain what's the importance of taking medications and compliance to the management plan. We have been able to do some investigations as well. We have lab support where we could do some blood tests. Interestingly, there was a radiology support as well, so x-rays can be done immediately and ultrasound scan.
By the grace of God, we've in this camp seen over 1,000 patients, which is absolutely amazing, and it's been such an inspiring and uplifting, spiritually uplifting time. So what is our motivation coming here? Well, as doctors, primarily our role and our responsibility is the service to mankind.
The people of Mbale and neighboring districts that benefited from this free medical camp greatly appreciated and were humbled by the humanitarian heart exhibited by Humanity First Uganda and its volunteers.
Nezera ano kina lwe ifuneko bujanjabi bulamu bwose bunaka buli bulayida ate ndi nakindi kwasimire basawu befe bano kukweza ano era ndi kukirosera bakujanjabe kuvenga busi kwaba kobala.
Monica Said reporting for MTA International Africa, Uganda.